phone to Shannon and Rob, and we'll get started. My name is Kevin Mickey. I am a former URISA president and honored to be the moderator of today's session. Really looking forward to this. I had the honor to be present when these folks got a well-deserved eSig award from URISA. That is a true honor that reflects an acknowledgement by the industry of excellence in services that leverage geospatial technology to serve communities. I think you're going to see one of the really great examples of that here today. URISA, I hope you all have taken full advantage of over the years in the educational offerings that it provides, such as this, plus its many workshops and conferences, including a very large one I hope everyone on this call is going to attend coming up in my neighboring state of Ohio. Here in October. That should be a tremendous event, and it is always a great thing to be face-to-face so we can get to know each other even better. This particular webinar is going to be on the Los Angeles County Equity Explorer tool. We have two presenters with us who I've gotten to know a little bit over the years. And I think you're going to enjoy having the same experience. Shannon and Rob, I'm going to turn this over to you. And if you guys want to take questions during the webinar, you're welcome to, or we can save those for the end. And everyone is also welcome to put questions in the chat. I'm sure as one of these folks is presenting, the other one can keep an eye on the chat and maybe answer those as we go. But we'll try to reserve a little bit of time at the end as well. So with that, I'm going to mute myself and go into hiding and turn this over to you guys.
All right, thank you, Kevin. 1 second, I'm just going to share my screen. And I would say, especially seems like a pretty small group here today. So definitely, if you have questions, feel free to just ask them, and we can make this conversation. So yeah, so feel free to either put in the chat or just raise your hand or just go off mute. So today we're going to talk about the Equity Explorer. This is a mapping application we developed at Los Angeles County, really to help inform project designs and direct county funding to communities that are most in need. So we'll talk about that, maybe a little bit more about just how we're using GIS technology generally to advance equity within the county. And yeah, we will do that as time allows. This is a collaboration, Chief Executive Office, and then specifically the initiative of the Anti-Racism, Diversity and Inclusion Initiative within that office, and then ISD, which is Internal Services Department, Enterprise GIS team, which Shannon and I are on. So we'll get to introductions in a second. But just quick agenda, just going to introduce ourselves, a little background of the tool, overview of the tool. We'll do a quick demo, and then we can do questions. So yeah, so I think we've essentially introduced ourselves. I'm Rob Graham. Shannon Julius is our other presenter. We're both on the Enterprise GIS team here at Los Angeles County, and we both worked extensively on this project. We started at the county about 2 years ago, and this was kind of the first project that we jumped in on, and it's really evolved a lot over time. I think it'll continue to evolve, so it's been successful and good so far. We worked closely, like I said, with the RD initiative, so we usually kind of let them present this slide, but I'll just highlight that this is an initiative that was created by our Board of Supervisors, really to infuse equity and anti-racism into county functions generally, specific and particularly around funding decisions. And if you can kind of see the things that they work on, capacity building, planning, data collection and analysis. So some of those are, we work closely with them as the Enterprise GIS team. So that's kind of some of the places that we come in on there. And then our team, we are the centralized kind of GIS capacity for the county. And so we support the departments in their use of GIS, things like licensing, shared databases, our server infrastructure. And then on top of that, kind of this last point is we provide consulting and technical services for custom data and applications, custom analysis and research, kind of on an as needed basis to departments. And so this is kind of how, in that capacity, we've been working with the CEO's office and RD on this project and on other projects as well. Well, so just jumping into the background. So this this project really came out of, well, the COVID pandemic. As I think we all know, it did not affect everyone equally. And so I think it both exacerbated current disparities that were in society. It really kind of illuminated some of those, made them worse. Some communities were more vulnerable than others. And you can see just some of the stats. I think we all know these, but in LA County, we had over 35,000 deaths, almost 4 million illnesses, and then we had unemployment rates in particular. We saw stark divides across race and ethnicity, and then also with income was another income, and then kind of like job function, like so how easy is it to be safer at home or whatever, and to be able to work from home and to be able to like keep your livelihoods. So yeah, so this kind of grew out of that. There were a lot of requirements that came along with that funding. So LA County got, I believe, like $1.9 billion of ARPA funding. And in addition to the federal requirements, which were, to use that equitably, the board actually also, the Board of Supervisors here in LA also passed a specific motion to ensure that it goes to communities that have been historically disadvantaged and that have experienced disproportionate impacts of the COVID-19 crisis. So this project of the Equity Explorer, and specifically the COVID-19 Vulnerability and Recovery Index, we're kind of getting to that question of where are communities most at risk, and who are the communities that are most in need, so that we could kind of help departments and help the county fulfill that mission to get the funding to the people who need it the most. So that led us to creating the Equity Index. This is like a census tract based index that develops census tract based index with 5 different need tiers from highest to lowest. And so as departments are designing their projects, they can use that to kind of have a baseline of how their funds are being allocated, or what communities they're targeting with their projects. And yeah, the Equity Explorer, the mapping tool, we essentially started as a way to showcase and basically make that index useful, and to inform the decision-making process, and then align the investments with areas of greatest need. And so with that, I think we can do overview of the tool and the index.
Right. So, Kevin, when we met at the Julius GIS Pro Conference last year, which, as you said at the beginning, everyone should go to again this year, you had this great session on indexes and kind of talking about the difference of vulnerability, and that's definitely stuck with us as we're doing more indices and stuff. But so this is an index that we created for this project, and the intention is to consider risk, severity, and recovery need as kind of these sub indices that are combined together. And you can see in the graphic on the left, we've got different data sets that feed in. So risk, we're thinking, okay, if someone, sort of how likely are you to be exposed to COVID? You know, what's the risk of actually getting it? Stuff like essential workers. If you're in an overcrowded housing unit, there's nowhere to kind of isolate at home. Severity. So if you do get COVID, how bad are you likely to get it? Asthma, seniors, heart disease, things like that. And then recovery need. So if, you know, how might the recovery need be modeled in this community? Access to resources, things like, you know, are there sort of other conditions that could exacerbate recovery from the COVID pandemic, stuff like unemployment in the community, uninsured population, and things like that. So each item is weighted equally within the sub-index, but some of them you'll see in multiple sub-indices. So it's kind of like a weighting. So we have population below 200% federal poverty level in each, because we know from the research and from other just data trends that that's going to be a really strong indication of both of risk severity and recovery need. And then we also have uninsured population and severity and recovery need. Mostly these come from publicly available data sources. Some came from the state of California, and I think those were the two main sources. For the health indicators came from the state. And then we're mapping these at the census tract level. So kind of looking at community conditions. It's all a model. We're trying to get a sense of how COVID would impact the risk, severity, and recovery need in these communities as a community level. And if you look at the screenshot, you can see there is clustering, as you might imagine, and just the way that the urban landscape is. But we've given each census tract as a ranking of highest need, high need, moderate need, low need, or lowest need. So parsing out where in the county would have a relatively lower need as a result of the COVID pandemic, and which ones would have the highest need as a result of the COVID pandemic. Anything else there, Rob?
That's good.
So a lot of the research and starting point from this index came from a nonprofit now called Catalyst California. It used to be called Advancement Project California. They created a project called Race Counts, which was highlighting, you know, the inequity in the COVID impact in the communities in California. So RD, the anti-racism group of the CEO, worked with Catalyst California to talk through their index, see if it could apply in LA County. We adapted that index. We took it from zip code to census tract geography. We pulled out race as an explicit index, although because this was going to be used to dictate funding, there's a law in California, Prop 209, that it's kind of like an anti-affirmative action law. We can't use race as the basis of funding decisions, but we can use things like income and essential workers. And so we can still target communities that are in need, even if they, you know, but we had to pull race out. And then we also looked by LA County. So we only did our processing in LA County rather than the whole state. So then what did we do with the index? So the board created a funding allocation formula. And those numbers, 40%, 35, 20, 3, and 2 that are highlighted in red, those correspond to the need tiers from the index. So 40% of all spending was supposed to be spent in the highest need tier for the COVID index, down to only 2% of funding in the lowest need tiers for the COVID index. And that's I think that's, I don't know if it's the first time that the board has done something like that, but it's really an intention. It's really the intention to be equitable rather than equal, right? We're not spending funding equally across the county. We're trying to really target those areas of highest need, high and highest need, and spend the vast majority of funding, 75% in high and highest need tiers in the COVID index. So then the next step is it's pulled into a web map, and the index can be used for project design, exploration, and analysis to see where these groups, these departments in the county, they're doing different projects, whether it's public health or it's social services, trying to provide resources. The money that's coming in from this ARPA, our big ARPA funding source, many different departments in the county are trying to get access to that funding in order to spend it for their programming to benefit the community. So they can pull up the map and look and see, okay, where are the high and highest need tiers? Where are the low and lowest need tiers? And they can kind of guide and design their projects around that geographically. The image you're seeing on the right is a report we'll talk more about in a minute, but once programs design the geography of their project, they can see the impact on different levels of geography. So not only, census tracts or high COVID need tiers, but in what supervisorial districts are those projects taking place, in what service planning areas, and in which cities and communities. LA County has 88 cities and a big unincorporated population as well. So knowing in which cities the project would take place is important. And then on top of the COVID index, we pulled in a lot of other data into both the map and the reports to show some other context. So if people are trying to target the homeless population, for example, well, we know that the homeless population may be at risk, but they may not be in this sort of general countywide COVID index. So they can pull in these other data sets in order to just do their program design planning. Limited English household, same thing, where maybe to adjust our strategies to get to the population we're trying to get to, in addition to the COVID index.
Yeah, I'll just add with that too. Something that's like resonated with me that Artie talks about is the index kind of being the floor of how funding is allocated, rather than kind of the ceiling or like kind of the end all be all. So it kind of gives if your project is hitting that funding formula, so if it's hitting the areas, according to like the 40, 35, 20, that's, you can kind of get fast tracked into having your project approved. But if it doesn't, like, we recognize there's lots of other ways to address equity, right? And so this one index doesn't capture everything. And so a lot of what we've done with the Equity Explorer is kind of adding on these other indicators and indexes that people can use. Sorry, just jumping in.
No, that's very helpful. Okay, so this slide, we're kind of looking at the different resources we use and the different software and processing strategies we use. So in the county, we do have a lot of resources, and I know that's not the case across every organization represented here, but we were able to leverage our team, the Enterprise GIS team, and also other groups in our IT department, some teams of developers. We had access to the Esri Advantage program, so we had Esri technical support on these applications, on some of this work. And, of course, the RD team who can guide the more equity and business approach. And they also did a lot of the hands-on meeting with the departments, walking them through this workflow, helping them understand the funding allocation formula, helping them understand census tract and COVID index and all of these things. So they did a lot of the kind of customer facing work or user facing work to help this project be a success. As far as our tools, we used Postgres as a process, as the database storage to quickly make the index, process a lot of data, quickly update the data. Can you all hear me okay? It says it's cutting in and out. I could try a different speaker if that would be better.
I'm hearing you fine, yeah.
Okay, so Andrea, you can always talk afterwards. We're using ArcGIS Online to host the feature layers, host the data after it's been processed, and every data layer you see here is available in our ArcGIS hub, in our open data platform, so you can use it today if you're interested in this analysis in LA County. And we also have mapping applications, ArcGIS Experience Builder. We use Survey 123, and there was a process that started in the ArcGIS Online platform for project design submissions that ended up going to a custom website that was built by our partners in IT and our developer team. So we kind of found the limits of the Esri technology a little bit. So if anyone has questions, we're happy to go into those details. But Survey 123, good for location, not good for really, really long descriptions of projects and things like that. And then we're using Python and SQL to automate data processing and reporting where we can, and to keep this thing updated every year as efficiently as possible, and to run these reports without having to actually sit and draw the geography ourselves and do the math, run the statistics ourselves. We've got a script that will generate reports based on user entered location information. How often does the data get updated? So far, we're doing an update run about every year. I think we're a little late this year, but because our data comes from different sources, not all of it is updated every year, but many of it, the ACS data, and some county data sets are updated annually. So for those, we try to update, and then we'll do the demo, but we make it really transparent which the vintage of the data, so that folks know how old it is. Okay, so on the upper right corner, you can see the Equity Explorer, which is an experience builder application in ArcGIS Online. The idea is that it's going to help department staff plan and evaluate their projects and programs. So they'll be able to look in and see not only the COVID index score and the amount of funding they may be able to use, but other data sets that will help justify their program and make sure they're targeting geographically the areas that they want to target. They can select census tracts in the application and export it to create a list of tracts. And then that list that they generate is fed into our equity report process. And then, yeah, additional measures of need not captured by the COVID index. Application features, we'll walk through these shortly, but you can click on the map to view detailed information and pop-ups. You can turn on and off different layers. You can use filters to filter the map. Yeah, and the COVID vulnerability and recovery index is kind of underneath all of the other layers. So all of the other layers, you can kind of compare how these different measures of equity in terms of the COVID index, and then download your filtered data sets and then map approved project areas. So, it's interesting to start with the Equity Explorer. Really what I'd like to rename it, if we could, is sort of the COVID or the ARPA Explorer, ARPA Equity Explorer, because it's really targeted around this COVID index. But what's been great is departments that needed to use this app as part of the ARPA funding justification, we've been able to kind of spin off different apps that target maybe more of the areas of interest to their programs and the equity around that. So even though we call this Equity Explorer, generally it's really just a starting point for departments to have this conversation and use GIS to map different data across the county. Oh, and the layers, here they are. They're all online. If you open the app, we've got a list, but I guess just to kind of cherry pick some of these HUD qualified census tracts. So that's around development and areas that may be eligible for federal community development funding. We've got redlining scores, historical data. We've got county data like CalFresh or food stamps recipients and a gap analysis there. We've got some we've got other indicators of vulnerability, sort of the right column lower down. We've got all these other indexes that folks can use in addition to the COVID index, things like healthy places, justice, equity need index, social vulnerability, the CDC layer, which is very commonly used around COVID and other things. And even things like reported hate crimes, which we knew increased during and after the pandemic. So a lot of great data there.
Cool. So with that, I think we can actually do demonstration. You can actually see all these layers. Yeah, so thanks for all of that, Shannon. So this is, we're just going to do a kind of a quick live demo. We can put this link in the chat as well, actually, and then people want to check it out. Just put it in there. But essentially, this started as using the index, and it's really been something that we've like as we were looking in that last list of layers, like this kind of, it goes on, and we've been adding more and more just to give kind of like a centralized starting point for departments that are researching equity. And so whatever, their project relates to, if it's, around income, if it's around policing, just giving kind of a first step into looking at all of those things. So it's a basic web map. You can see it's visualized on the index. So you can see, if you know LA County very well, you probably won't be surprised to see the way that this, need map looks. A lot of, you can choose other indexes and it often looks similar, unfortunately. But if we click into some of these, we can see more detailed information. So like in this tract, we can see like an overall score. This is 0 to 100. You can see if it's at what need level it's at, and then you can actually see the component breakdown. So like the risk, the severity, the recovery need, like we were looking at, and then overall. And then each of these other layers, if we kind of visualize those on top, for example. So for example, we have like this Justice 40 layer, which is a prominent layer that layer from the federal government that has need, that also is looking at need in like another list of indicators. You can see that like it has a disadvantaged versus not disadvantaged. Along the same lines, it has components into that index. We can look at things. A lot of these we symbolized as like proportional points on top of the index, which kind of lets us see like, okay, if we're looking at households without a vehicle, we can see like where are high need tracks that also have these higher concentrations of the bigger circles of higher percentage of households without vehicles. So we have all of these layers to explore. Then we have our core COVID filters. So there's different ways you can filter the COVID index itself. So one is the countywide statistical area, which is basically like a community or neighborhood, but you can use, for example, one request we get a lot is, what does it look like in the unincorporated areas? Because like, as the County of LA, that's something that we have more purview over, versus things that are in the cities. So you can see kind of where the highest need tracks are only in the unincorporated areas. And then you also see these statistics at the bottom as you do filters of those. You can see how many people are affected in those places, what the average index score in the quintile is. And then these quintiles kind of line up with these need tiers. Similarly, we can do like by supervisor district. That's another really common question, is kind of like, how does one supervisor district compare to others? Or like within my supervisor district, what areas should I be targeting? So here, if we're looking at 3, this is supervisor district 3. If you want to get to the communities in highest need, you're going to be looking at these communities up here, and not necessarily like in Malibu, for example. And then you can see kind of how it breaks up. And then again, these are updating along the bottom. So you can see like District 2 has a pretty high concentration of highest needs tracks. It has an index quintile that is almost all the way to the 4 level, just overall as the entire district. If you compare that again to 3, you see it like drops, we're at like 2.5. So you can just see that there's the need is not evenly distributed, across the county. And with that, once you and I will show, like Shannon was saying, so let's say you were looking in this area, so then you can actually see the data. And so here, like I've got District 2 selected. So from here, I can see, the index, the components, all the kind of like indicators that go into the index. So overcrowding is one of them, 200% federal poverty level. that sort of thing. And then you can download this. And then if you do that, we have a script that we can run it through, and I'll just show you. And we create these equity reports. And so like for this, for example, is just taking all the census tracts that are in Supervisor District 2. People or departments that are designing their projects can select like actual census tracts on the map for where their targets or where their projects will be targeting. And so basically it takes a list of census tracts, whatever they are, and breaks it down by the need tiers to the percent of tracts and how that lines up with the board approved formula that we were talking about. How your project is lining up against supervisor districts. Obviously, in this case, it's all District 2. The service planning areas, and then you can just see like other things like qualified census tracts, some US Treasury final rule income thresholds. This is another thing that we've been adding to over time, like as the need comes up. So it's, the department is like, we need to know, people over 62 or something like that. We'll kind of add that as an indicator into this report. So then when they're doing their project designs, and they can get that information. Again, hitting some of the existing programs like certified community businesses, CalFresh cases, this concentrated disadvantage index, which was also developed by our team, mostly Shannon, has been used across, a lot of projects and a lot of funding decisions as well, as kind of like identifying the highest concentrated disadvantage and like what percent of tracts in District 2, for example, are identified as highest concentrated disadvantage. So here it's like almost half of them. The other, vulnerability index, healthy places index. So just really kind of this long list of demographics and indicators that people can look through. And then in addition, like actually like on a tract by tract basis, like, you can see like which ones are, like looking through like, oh, I want to just like take this like starting point and I want to get, maybe just the highest and high need tracks. And then that kind of gives you, again, like kind of a starting point of how you can design your projects to hit those places in the county. Some of these projects that we've been starting to map them. And so the ones that, if we have a list of census tracts, for example, this is just the same index underneath. But this just gives us an opportunity to see like, oh, it's like Project Home Key, which is like a rehousing program. Like, how does this project kind of lay out in the county? So how many census tracts is it covering? What's the population in those census tracts? And then along the same lines of, the kind of average index score and quintile. And then you can just also see visually, like, is this hitting like, for the most part, the highest need areas in the county. And then we did not develop this, but this was also on our team at ISD, have taken some of this data that's come in and created this this project dashboard where you can see partly things of like how it's broken down into like types of projects, strategic pillars, which is kind of like an art way of talking about some of these things. But then also, what are our like actual, how are we actually funding these? How are the funds actually being allocated versus like what the actual target is? So you can see like we're not fully hitting these targets. But like we said, there are reasons beyond the index to fund a project, obviously.
I also think if you highlight over the actual, you can see that even though, like, yeah, even with all this effort in the Equity Explorer, we're still not hitting the targets, but at the same time, just that equality versus equity idea, we're definitely leaning more towards the highest and high need tier. So I think, the system is working even though, we may never hit that ideal target, we're still not equal across the board.
Absolutely. Yeah, and then you can see actually at this dashboard, you can also see kind of for individual projects how it lines up. So, for like interim housing beds, for example, it looks like it's very much like toward like the highest need tiers. So, and you can see that most of the projects that we're doing, some of them pretty evenly distributed, like this one, but for the most part, I think the county is doing a good job of like Shannon said, focusing on equity versus just equally dividing all the money. And let's see with that. Go back to here. I think that is basically what we had for our presentation. I think this was one other thing that we might show, or at least share this link to. So I'll put like a number of links in the chat, and then we can also share this this slide deck as well. But this is just a hub site that we've created, and maybe I should just show it since I think we have the time.
Yep, you have time.
Yep. Just a place to see like, featured equity applications that the county is working on, along with the data sets the county is working on. And while I'm talking about data, actually, let me show one more thing here is this map about the layers function of the Equity Explorer. So if you're looking for metadata on any of these layers and any of the timeframes of when they came from, you can go here, and this gives you, kind of like more information links, and then also links directly to the source of each of these layers. You can also, in our open data portal, if you just search for Equity Explorer, you can get to each of these data sets individually. So hopefully this along with the hub that we're creating is kind of streamlining some of the countywide equity work that we're doing, to try to not have so much duplication and have kind of, we can put out these authoritative layers, and then people can use them in their own kind of research and analysis and projects.
And yeah, the Equity Explorer is one of many applications countywide that are recently published or in development around equity. And yeah, going to the tools and apps, you can see by department, which is maybe not as useful for everyone, but certainly for us internally, you can see how we're looking at different equity data sets and indices, while trying to address the digital divide, while trying to address COVID recovery, while trying to address homelessness. And this app is one we kind of get together as GIS professionals in our organization and try to update every couple months. So we're trying to keep up to date with what different departments are doing. So yeah, we reduce duplication of effort, and use the data that other departments have used. So these are external, we haven't created any of these, but we want to highlight them because they're ones that we reference a lot in the Equity Explorer and in other applications. Just like, how did you make that decision? While we're looking at calendar screen, we're looking at the Justice 40, also known as the Climate and Economic Justice Screening Tool, things like that. So definitely encourage you to check it out. All of our data in our application are up here, and all of the other equity related applications that LA County has been working on, ideally, at least the ones that have GIS professionals involved.
Well, thanks to both Shannon and Rob for a tremendous presentation. I think you did a terrific job of showing why the ESIG award was well deserved. You've only continued to grow that project. I'm excited every time I see a presentation. It's always something new with you guys. Really impressive. I've got a couple of questions, but It's not about me today. I want to give the folks that dialed in on the call an opportunity to pose any questions they may have. You know, maybe you've gotten some ideas for how to do some of these things in your own communities. So does anybody want to ask a question either in the chat, or you can unmute yourself? I'll throw one out to maybe get things started here. You know, you and I have had a chance to talk a little bit offline. You know, I'm curious with all of one of the things that ERISA's worked on over the last few years is some guidance for communities on how to leverage all these public domain indices that are out there from CDC, from FEMA, and from other federal agencies especially. You guys are part of a growing trend that is developing regional or local indices that address specific questions. And I'm kind of wondering, have you seen opportunities for how those two sources of information maybe complement one another, or do you think that you know, your approach is the way to go for all communities? I'm kind of curious on your take on that, because I know you did a lot of background research as you were working on this tool.
Yeah, you know, we did a lot of background research. We also had a lot of, I'd say, community input to this, especially this particular index that we created. You know, it was based off the one from Advancement Project that was, you know, they're a nonprofit kind of civil rights organization. And so kind of taking that trusted source, and they also have a lot of connections into other community organizations, and getting that. And, you know, when we were doing things like, oh, we can't use race explicitly in this, how are we going to, you know, what other indicators should we have in here instead? They were actually able to go and kind of poll their community groups and have, you know, panel discussions and that sort of thing to kind of give that community and like research community input into that system or into that development. I guess I would say in terms of working with them together, in terms of like the larger indexes versus these kind of more custom ones, you know, I think one thing is to recognize that the larger indexes are generally applied to a larger space, right? So it's either like nationwide, or, you know, if it's Cowan virus screen, it's the state of California. And then a lot of these calculations are done on kind of like a percentile basis. So, you know, it's relative need. And so I think being able to localize them is an important step, because, you know, if you look nationwide, like you might just get kind of like all of LA County is like super high need, right, on some index, for example. But, you know, there's not infinite funding, there's not infinite resources. So being able to say, okay, so, you know, everyone, let's say like a lot of the county or a lot of us, you know, have a need for a particular program or would benefit from a particular program, like how do you actually just kind of like assess that within the county of how we're going to get to the people within the county that actually need it the most.
It's really helpful. Shannon, do you have anything to add?
Yeah, I mean, it's interesting because we've had the opportunity to create a couple indexes now. And one of the ones we made more recently actually was a nationwide index at the census tract level. It's hard to do. It's hard to make custom indexes. You have to take into account states and counties and tracts that don't follow the same rules as everybody else. And I think you end up with, yeah, you lose that localization of need, and you also can, let's see, you can, I don't know, so I think the more you can build off the work of trusted sources, it can be really helpful. You know, but at this, you know, looking out, right, but looking sort of downward in scale, I hope and expect that, you know, we have 88 cities in LA County, and we've sort of done the work to create this authoritative index that works perfectly fine for all of these cities. I think I can't imagine there's a reason for any city in LA County to redo this work. I don't know if anyone from any cities in LA County are on the call right now. So I would say, you know, maybe there's something in the middle where it's not at the scale of your jurisdiction, but it's made sort of in a middle tier, like in your county or some planning authority, maybe some multi-county agency that you can get somewhat local without having to start from scratch. That might be another good option. Yeah, I think just really understanding the role of every data point in your index. And we didn't really have to do that work for this because the nonprofit, our trusted partner, had done it. But you know, if you are starting from scratch, each data set needs to bring something to the table, hopefully without just duplicating something another data set has already said or is already bringing to the table. So if you do start from scratch, I would just encourage you to say, okay, we're including this variable for this specific reason, this variable for this specific reason, because there will definitely be questions and and justification, especially if you're saying, hey, we have to spend money in this district and not that district. That's kind of where the rubber meets the road of this work in our experience.
That's really insightful. I appreciate that from both of you. We've got a couple of great questions that have come up here. This first one's from Steve, and it exemplifies, frankly, I'm hoping all of the people on this call are your ERISA members. If you're not, here's a reason that you want to become one. We learn from each other. You know, we're not all about reinventing the wheel. Nobody has the time or energy to do that. So Steve's question kind of lends itself towards that. How easily could another community, potentially, maybe one represented in this call, adopt the underlying framework that you guys have built? Have you documented it? Is it available via GitHub or some other location? Who wants to tackle that one?
Sure, I can tackle it. Yeah, well, I think in terms of the index itself, I mean, I think that's fully documented. I can actually probably bring that up because I think I have it open here. So it's here. You can go in and you can see like exactly like what the data sources were. I'll give this a second to load. And a description of the process for, you know, kind of how we did it. So this gives us like kind of the process, kind of how we broke up the indicators, how do we define essential workers? So it's like all of these specific variables from the census table. And looking at like the numerator and denominator for each. One thing that we've had trouble with is getting updates to some of these, like asthma hospitalizations, gun injuries, heart disease. These all came from the OSH-PD patient discharge database. That requires like a special request to them and potentially payment, I believe, to actually get that data. And so, you know, we kind of got one set of it that we use in the initial index. This is something that we need to look at, like how we're going to be able to update that. Yeah, and so does that I feel like I'm missing part of the question, but yeah,
and if anyone wants
Shannon.
our SQL, you know, code or SQL code, you're welcome to ask. Of course, you have to kind of have the same table names, but we've got, yeah, that's available. It's not on GitHub though, I don't think, unless it is.
It is not currently, and I think that that's something that that we need to work on as a department, is getting more of our like actual like code, SQL code, Python code made a little more publicly available. But at this point, I would say ask us for it. We can definitely give it to you. And then if you kind of have those tables set up in your database, then it creates the index from there.
If you guys are willing to put your email in the chat, I think you might be getting a few messages. So we got another question. I love this one. I was going to ask this myself, Rachel, so I'm really appreciative of you doing so. Rachel asked, Are there any examples, I'm going to paraphrase, of departments or others within the area served by your indices that have used the tools to get grants, to meet program requirements, to convey information? You know, it's always about not the how we did it, but the so what. What did it accomplish? So are there any really good examples you guys can share for those?
Yeah, so well, it's interesting, you know, do you say nonprofit? Yeah. So what we have documented on the site, Rob, it looks like you're gonna pull up, is 4 county departments that have gone through this process. And again, it's a required process that they go through CEO, they go through the anti-racism diversity inclusion group, but they use the Equity Explorer, and they generate this equity report for their proposed project. 4 departments that have gone through this process for ARPA funding. They are all documented in here, and they're pretty cool. I mean, as far as the stories of those departments and how they're being documented, I'm not totally sure if we've done that. I know it was something they want to do. And then I think many of these get subcontracted out to nonprofits, so they'll do sort of requests for proposals to someone to actually administer this program. So I think the funding does trickle to nonprofits and maybe NGOs of some kind to administer. Oh yeah, and here's the description of them in this. That's right, in our projects viewer. So yeah, so part of the project is kind of bringing this together into this map and into the summary dashboard. Yeah, a lot of work with homeless, a lot of work with Delete the Divide, you know, giving people access to internet computers. Yeah. And I think there may be, oh, go ahead, Rob.
I was just going to say, like you were saying, like it's for all of this ARPA funding. I mean, RD was really the gatekeeper for that. And so every county project that utilized that funding source in order to like do their projects, they had to kind of go through this process of you know, aligning their project with kind of the equity needs, and if it didn't line up with the index, you know, and that funding formula, you know, really using some of those other data layers or some of the other indexes to provide justification for like why, you know, why they were spending the money in the way they were doing. So.
Well, again, you guys have done some amazing work here. We've got maybe time for one more question if there are any. If not, let's see. Yep, looks like that's it. All right. Well, again, Shannon and Rob, this is just amazing work that you guys are doing. I personally will thank you for this. This is an area I know I'm professionally interested in, and it's always really awesome to see what communities are doing across the country. And Los Angeles is certainly setting a pretty high bar on what can be done. And more importantly, in my mind, you're more than happy to share. If you haven't gotten a chance to know these two, please take advantage of that opportunity. You guys coming to Columbus by chance? I hope so. Maybe.
Not
Be
sure.
determined. Yeah. They better. So Steve.
All right. Well, that gives me
support, maybe.
That gives me. Steve says you better. Sounds good. I just got you a trip to Columbus. I hope.
Nice.
So, so let me take advantage of that little connection here. There is a lot more coming up in the ERISA world as far as education. If you've not already signed up for the Public Health GIS Strategy for Effective Leadership webinar on July 20th, there is a connection, right? You know, so take advantage of that, because we're talking about equity, and public health is most definitely relevant to that area. We've got yet another ESIG webinar coming up on the great work that Sussex County did in August, and we have, excuse me, that amazing. And if you've never attended a ERISA GIS Pro conference, don't make the mistake of missing this one. This is going to be a terrific one in Columbus, Ohio, coming up in October. Steve, it looks like you might have a comment. Did you have a question?
I don't think so.
Yeah, you had your hand up, so that's
I
okay.
that was me trying to clap and hitting the wrong button. Sorry about that.
That's all right. It's always great to have you to chime in no matter what. So I do believe that we have 5 minutes. I'm going to grant you back so that you can take advantage of that this afternoon. And again, thanks for attending this ERISA educational opportunity. Thanks especially to Shannon and Rob for a great presentation and for the terrific project you did. And I hope to see everybody soon in another educational event and definitely in Columbus in person. So thank you all.
Thank
Thank
you,
you.
everyone.